All right, so we come below the diaphragm to the abdominal aorta, and we're going to start with the digestive and abdominal vessels. The first exit off of the abdominal aorta, way up under the liver, is the celiac trunk. The celiac trunk is a short little extension of an artery that comes off the abdominal aorta and then branches 3 times. So I can see 3 distinct vessels coming off of the celiac trunk. The leftmost vessel is the splenic artery, which comes off to the left and goes to the spleen in the upper left quadrant. The rightmost branch is the common hepatic artery, which goes off to the right and up into the underneath side of the liver. And then the third branch here looks different from model to model, but this is the left gastric artery, which is going to come off the celiac trunk and then do a little loop-de-loop on the back side of the stomach. So the stomach isn't here, but this loop-de-loop is the left gastric artery. Then if I could go back to the abdominal aorta and go down to the second exit off, this is the superior mesenteric artery, and it comes out of the abdominal aorta just above the renal artery and vein on the left and the renal artery and vein on the right. So going back just above those renal arteries and veins, which are going to the kidneys, this is the superior mesenteric artery. It comes off the abdominal aorta and kind of cascades downward like a waterfall. So next are the right and left renal artery and vein, right and left renal arteries and veins. And if I keep going down, the lowest point before the abdominal aorta splits is the inferior mesenteric artery, which comes down way low and provides blood to the lower part of the intestines. On the venous side of things, often the vein is right next to the artery. So we'll kind of review everything a little bit. The splenic vein comes out of the spleen and comes across this way. The renal veins come out of the kidneys and go directly into the inferior vena cava. So for blood flow, it would go renal vein into the inferior vena cava. All of these other veins, including the splenic vein, are routed into the bottom of the liver so that the liver can filter these products of digestion and worn out red blood cells that are being collected from the spleen. And so all of these other veins are going to be routed into the hepatic portal vein that goes into the bottom of the liver. So the splenic vein comes across. This here is the inferior mesenteric vein, which was joined up with its arterial partner down here, but it had to diverge away to come up and join. The inferior mesenteric vein merges with the splenic vein, and then the splenic vein merges with the hepatic portal vein up over here to go in the bottom of the liver. Here's the superior mesenteric vein, which runs alongside its arterial partner and then goes up into the hepatic portal vein. And the left gastric vein is running right alongside the left gastric artery and does the same thing. The vein comes over and connects into the hepatic portal vein going into the bottom of the liver. If I look at the top part of the liver at the back here, which might be hard to get the camera in there to see, I can find a vein that comes out of the top of the liver and goes straight into the inferior vena cava. That vein is called the hepatic vein. So the hepatic portal vein delivers things that need to be filtered into the bottom of the liver, and then the hepatic vein brings the products that have passed that filter or that are added into the bloodstream out and puts them into normal circulation in the inferior vena cava. If I come back down to the blood vessels for the lower extremity, if I go back to the abdominal aorta is going to branch as soon as it reaches the pelvis to the common iliac artery on either side, and then the common iliac artery splits again pretty quickly to the internal iliac artery and the external iliac artery. The external iliac artery will continue and come out the front side of the pelvis alongside the hip flexors, and as soon as it passes out of the pelvis, we're going to call it the femoral artery because it's in the thigh in the femoral region. It extends down toward the femur and branches to the deep femoral artery, which is this little offshoot here that doesn't seem like it would be deep. Then the femoral artery continues down, kind of twists along the medial edge of the femur to run to the back side of the thigh. and continues down along the backside of the knee. So the femoral artery becomes the popliteal artery at the backside of the knee. And then down in the leg, it's going to branch 3 times. So the first branch that comes off comes through between the bones and around to the front side of the tibia. This is the anterior tibial artery. The next branch comes down the back side of the tibia and is the posterior tibial artery. And the very last branch point runs laterally over to the fibula, and this is the fibular artery. On the venous side of things, we have all of those veins and a few more, like the pattern we've been learning. So this is the fibular vein running right alongside the fibular artery, the posterior tibial vein running right alongside of its arterial partner, and then around on the front is going to be the anterior tibial vein running right alongside of its arterial partner. The extra vessels in the leg running up the lateral side of the ankle and then connecting in with the femoral vein just above the knee, this is the small saphenous vein. And then if I look at the leg from the front and the thigh, running up the medial edge of the leg and then continuing up the edge of the thigh, this is the great saphenous vein. So much larger in the medial most vessel there. And then the deep femoral vein runs right alongside the deep femoral artery. The femoral vein is the largest vein running right alongside of its arterial partner. Then it's going to run back into the pelvis and turn into the external iliac vein. Here's the internal iliac vein, providing blood supply to the organs of the pelvis. And then those join together to the common iliac vein. And the common iliac veins from both sides join together to the inferior vena cava and then back up into the heart.